Hi there. Have you ever had a toothache before? So what to the end, I'll tell you how a simple toothache can lead to a swelling in the face if not treated as soon as possible. So now story time. I'm Dr. Nduka Chidinma, by the way. I've had several patients, okay, calling on the phone and they're like, "Oh doctor, I have this toothache. It's unbearable." And I'm like, "Okay, can you present to the clinic as soon as possible?" And then this thing is always happening during the weekend. And I'm like, "Okay, so what's gonna happen is that I'll place you on some drugs, okay? It's not something that will totally take away the pain. So you place them on drugs, and the pain goes, and then these patients they don't come back again. It starts giving you this swelling on the face. It starts giving you this swelling on the face. You start, you know, tasting some things like salt in your mouth from time to time. The pain comes by itself. The pain disturbs your sleeping. You can't eat properly. You can't even do anything because of that pain. So first of all, that pain you're feeling, okay? Your body is simply telling you that something is not right. The pain continues, and as it continues, it tracks down. In fact, it even affects the surrounding teeth. Let's say someone presents and then the person has maybe a tiny hole on the teeth. Tiny hole can be, filled, okay? But now, when you leave that tiny hole, it gets bigger to the extent that it involves the pulp. The pulp is that third layer in the tooth. You still leave that hole low, let it get bigger. It keeps tracking down. If you don't do anything about it, your face starts swelling. You start seeing something like salty taste in the mouth, so pus starts coming out. By that time, the tooth is not so restorable. So now your dentist would assess you to now know if they can still restore that tooth, or it's something they have to remove entirely. If you have a tiny hole in your teeth, see your dentist as soon as possible. If you've ever felt a toothache, please do not manage it. Don't use touch and go. Don't use battery water. Okay, trust me, you're not doing your dentist a favor. You're doing yourself a favor. So please send this to your friends. Keep following the channels to learn more about dentistry. Thank you.